Hey everybody, Danielle Hargenrader here. I'm happy to bring you another episode of Unleash Your Inner Diabetes Dominator with today, super excited to bring you Dr. Sheri Colberg. I'm going to read her awesome bio and then we're going to get right to it. So, Dr. Sheri Colberg is synonymous with exercise and diabetes. The world's leading expert, she has trained hundreds of diabetic research subjects and advised diabetic exercisers around the world. The author of 10 books and 300 articles, she is best known for Diabetic Athlete's Handbook, which is the Bible for active insulin users, as well as Exercise and Diabetes, a clinician's guide to prescribing physical activity, which is published by the American Diabetes Association. She combines almost 5 decades of experience as a type 1 diabetic exerciser and a PhD in exercise physiology to help people with diabetes exercise safely and effectively. Find more information on her websites, www.shericolberg.com and www.diabetesmotion.com. And I just want to say I'm going to post those websites under this interview, so if you didn't get that, don't worry. You can just scroll down and grab that. So how are you doing today, Dr. Sheri? How are you?
Great. Thank you so much for having me on. I'm looking forward to chatting.
Awesome. No, I'm thrilled to have you, and I appreciate your time. I'm sure everybody out here is glad to hear your perspective. So we're always talking about our kind of road from diagnosis to where we are now, and I would love to hear a little bit about your diabetes story, if you're willing to tell us.
Well, it started back in the dark ages of diabetes. It's not as bad as what of some other people I know who actually had to take the stones and sharpen their needles. But when I was diagnosed in 1968, I was 4 years old, and we did have to my mom had to boil hot water and run it through the glass syringes and that sort of thing. There were no ways to test blood glucose. So I guess what I enjoy most about my life now is that I can find out what my glucose is at any time, which is so refreshing to be able to do. I don't care about sticking my fingers. I'll do it 18,000 times just to know. So
I hear you.
And there just wasn't a lot of information available back then. My mom was kind of on her own trying to figure out what to do, but she did do some really good things. One thing is she decided that she would change the diet for our whole family and not just me. I had an older brother and my dad and her, and she just started cooking healthier foods. We removed the Fruit Loops from the kitchen. That was actually, for me, the worst thing about getting diabetes at age 4. I had to give up Fruit Loops. That was traumatic. It really was. And so I grew up eating a pretty healthy diet, lots of vegetables, and when I eat dessert, I will go for strawberries or something that's like a real food as opposed to a processed food. And I think as a result of having diabetes that I've lived a very healthy life. And some other things happened along the way that sort of influenced me a little bit too in my career choices and what I've done. One thing is that when I was a kid, I didn't know anybody else with diabetes. The only person who had it really was my grandmother, and she had type 2, and they just called her borderline. So they didn't really, did you see the cat walk by?
Yeah.
They didn't actually diagnose it, so it really wasn't treated effectively. And when I was about 12 or 13, I went to visit her one summer for a couple of weeks, and she was on yet another diet. She was kind of short and had all the abdominal obesity. She looked pregnant from the side, thin from the back. It was all on her belly. So, but she was on Weight Watchers, and I don't know how we arranged this, but I had agreed to help her with her diet while I was there for a week, and she was going to pay me $1 for every pound that she lost. And I had her running laps around the backyard, and I'm measuring out her cottage cheese and doing all sorts of stuff. And in the first week, she lost 8 pounds.
Wow.
Of course, I was a rich kid, back, 35 years ago. But what I didn't realize at the time, didn't know, is that it's not uncommon to lose that much weight the first week of a diet. A lot of it's water weight. And she likely gained it all back when I left anyway. She stopped doing the behavior changes that were helpful to her. But so the next step was kind of that when I was in my early 20s and doing my graduate work, I'd already decided I wanted to do physiology. I'd been exercising my whole life, without a meter, and it still always made me feel better. So I knew there was something to exercise. I just didn't know what it was, but I really wanted to focus on exercise and diabetes and why that was such a good combination. But anyway, I was a graduate student. My grandmother started having some of the cardiovascular problems that are often associated with diabetes that's not well controlled. And so she had a heart attack at age 70, and then at age 72 she had a massive stroke, and then she had a series of strokes after that that left her bedridden and unable to communicate or feed herself, and then she had partial amputations of both of her legs from ulcers that didn't heal. And I remember seeing her in bed, and I just said, I don't want that to be my life. I don't want to live like that. I mean, she spent 6 years, the last 6 years of her life were completely worthless, in my opinion. And so my focus has been more on being healthy while I'm alive, not so much on longevity. Of course, it's great to have a nice life, but a long life, but not if you're not healthy. And so everything I've done has really been more about improving quality of life for people with diabetes, myself included, not just increasing longevity. A lot of times when you improve, you also increase the longevity. And so that's, I guess, was a big pivotal point in my life in terms of deciding really what I wanted to do. I had originally been studying to be a medical doctor and decided I hated hospitals and sick people. So I've been trying to work with healthy people and trying to keep people healthy, or helping people who are not doing as well become healthier.
Right.
So that's sort of been my calling.
Yeah, no, that's amazing. You said so many things, and I want to touch on a lot of them. I think the first thing is that it's amazing that when you were diagnosed, that your mother was able to make that switch over to the healthy foods, because I think even nowadays, with all of the information that we do have available, because even when I was diagnosed, there was no internet, although it wasn't 68, but, you know, even though we have the information available, and doctors often do tell you, now, did your doctor tell your mother what you should be eating, or where did your mom get that information?
I don't think so. No, there was a diet. What I remember the most about it is that there were 3% and 6% vegetables. So basically there were the vegetables that you could eat whatever you wanted of, green beans and lettuce and cucumbers, and then there were the 6%, which they considered starchier vegetables like peas and corn and potatoes and stuff.
Mm-hmm.
I still think like that. I mean, I think, okay, that's a starchy vegetable, so they don't really count as a vegetable. When I eat dinner, half of my plate every night is vegetables, non-starchy vegetables. They're green vegetables, a lot of times broccoli, cauliflower, lettuce, whatever, you know. But that's just always been a part of my life. And that way I can eat lots of food and it doesn't have much of an impact.
Right. No, that's awesome. And that's perfect, because I think a lot of people struggle with that switch. Even if you are a child and you know there's a parent there that has that ability to change the diet, I find that there's often a lot of information overload, or they don't know what to do, or they're not willing to change the whole diet of the whole family. So that's amazing, and your mom is a saint, and that's awesome that she did that. And it's I also had a similar experience as you, although I didn't have the grandmom with the type 2. I did have a lot of, I was always a nerd, a self-proclaimed nerd. I love to read and learn, and I always do. And I saw the pictures of the amputated feet and the things like that, but I also read in the book that said, and I wish so badly that I remember that. I mean, I must have been 15 years old when I was reading this book, but it said that specific words of not well-controlled diabetes said that you can prevent this from happening by eating healthy, exercising, maintaining healthy blood glucose levels. And I thought to myself, well, if that's up to me, then I'm never going to have that happen. I'm going to do these things that the book is saying and things like that. And I didn't actually start doing them until my early 20s, as I spent, my teenage life at 200 pounds, and exercise was foreign to me. But after I realized the detriment that I was doing to myself, that I was in control of my choices, not necessarily in control of diabetes, because sometimes no matter what you do, you have some type of illness, your blood sugars are still going to rise. But on a general basis, 80% of the time, you can maintain those blood sugars if you do the things: eat right, exercise, and you're consistent with it. And I made that same decision. I'm not going to be having that happen to me. So I'm glad that, we can have that epiphany, and I think everybody out there can have that epiphany too, is that it's hard. Yeah, it's not going to just be, one day. You have to do it every day, but it becomes a habit. So, yeah. So, take us further down the
That
road.
was very helpful. I think it was because she was more into holistic health and stuff. She did a lot of reading Adele Davis and Prevention Magazine, and just some of those earlier pushes towards having a healthier lifestyle. But so for that, I'm grateful for her that she was able to do that for me and the whole family, actually.
Right.
It's funny, I've eaten Fruit Loops as an adult, and I go, oh, God, those are horrible. I can't believe
Yeah.
Yeah, I've also found, too, that it's really hard to eat foods like that and precisely match the insulin to them, even though I know when people get diagnosed now, they tell you can eat whatever you want. But in my experiences, it's not as easy to eat certain things as it is to eat other things. For example, because I went the first 18 a glucose meter, I found that I sort of gravitated towards eating foods that are lower glycemic index, that don't spike my glucose, because when I would eat something that spiked my glucose, I would just feel tired and cruddy afterwards, and that's part of the reason why I started exercising too, because I always felt better. But I find that I still eat like that. Sometimes when I'm having a low, I'm looking around my house like, where's something high glycemic that I can eat? I mean, I usually use glucose, but I mean, if I'm looking for a follow-up, sometimes I struggle to find those things to eat in my house.
Yeah, I'm the same. I don't keep, and that's one of my rules is, if it's in the house, it'll probably get eaten. So in my house, there aren't things that shouldn't be. I don't say shouldn't be, but I choose not to eat so I don't feel, like you said, kind of, because I'm a big kind of proponent of listening to the signs your body is sending you, and your body's always sending you signs constantly. So when you eat, Skittles and M&Ms, and then you feel like you need to take a nap, it's because your body is shutting down, versus if you had an apple, you wouldn't be feeling the same way. And I even tell people too, as far as bolusing, like you said, for a certain amount of carbohydrates, if I had a handful of Skittles that was 15 carbs, or I had a small apple that was 15 carbs, that would take a different amount of insulin. I'd need more insulin for the 15 carbs of Skittles versus the 15 carbs of apple, even though it's still 15 carbs, because of that glycemic index.
All carbs are equal, and that's actually another thing. I know they teach people to carb count, but I don't. And the reason I don't is because I don't find it's actually very useful for matching insulin to food, because it's not all just about the carbs. It's actually about the types of carbs. If I'm eating legumes, they're not going to hit for an hour or more, and if I gave the amount of insulin that it would take to cover those, I would get low, and then I would get high, and I'd be eating when I'm full, and then I would be chasing my glucose down later. And so I really look at it as a whole thing, like, what am I eating? What is the general glycemic effect of this meal? If I know the majority of it's going to hit later because it's a little higher in fat or higher in protein, or it has really low glycemic index carbs, then I will actually just take a little bit of insulin to cover it, as I'm on a pump vacation. But if you're using a pump, you can adjust it to dual wave or whatever kind of bolus you want. But you don't give all the insulin up front, because that's not when you need it. And so there's a big fallacy in teaching people just to carb count and then expecting them to be able to manage their glucose 24/7, because it's not going to do things that they expect it to do.
Right.
Now, on the other hand, you can use that to your advantage. If you know you're likely to get low later, you can consume things that take 3, 4, 5 hours to fully digest that will have an effect on your glucose later, and use those to try to prevent yourself from dropping later on. So it's just a matter of really understanding the effects of the various foods and when they're most likely to hit you, and realizing that having to inject insulin or pump insulin is not a perfect equivalent of if your body could release it. So even if you give it, it doesn't mean that it's going to perfectly match up with the food.
Right. So, and I think too, for me, I have I actually just got a pump. I'm coming up on my 1-year anniversary with my pump. Out of 24 years of diabetes, I've had 23 years of injections, and I just chose the Omnipod pump for the freedom without the tubing, and I really do like it. But I kind of equate it to a cell phone. It's like people have no problem picking up your cell phone every 5 seconds to check a status or check who's texting you or check who's trying to call you, but you might want to just check, more often on your devices. How's your blood sugar now? Check that hour after you eat. And sometimes you have to make micro corrections. Sometimes you're going to need to get a half a unit. Sometimes you're going to need to kind of manage it every hour or so. But it's the same thing. It's like, I know you might not want to, but if you're able to do it with your cell phone, I feel like it's a priority issue sometimes, and a lot of people don't feel like they are the top priority. And I feel like in order to maintain a healthy level of blood sugars and all of this other stuff, you have to be able to kind of give yourself that love, that say, look, I am a top priority. I do deserve this attention and that kind of thing. So, but I think you are like one of an anomaly that was ingrained into early, which is fantastic. But we need to teach you. I think you're worth it. Everybody out there, you're worth checking your blood sugar every hour. You're whether it's on a Dexcom or whether it's on your finger prick, you're worth it. It's not a chore. You get to do it, because Sheri didn't even get to do it when she was younger. She went 18 years. She couldn't even know what her blood sugar was. I didn't know what mine was until I don't even remember how many years. I just had to wipe the blood off and hold it up to the vial and hope that it was in a color range, that I never knew exactly what it was. But we get to know now, and I find that to be more of a privilege than a chore. And I think it's just a perspective thing.
Yeah, the people that were diagnosed before, I did interview close to 60 people who lived a long time with diabetes for one of my books, and it was really interesting because the people that had not had that from the beginning were just so happy to be able to test that it was like a privilege. And then the rest of people who got diagnosed later were a little bit resentful that they had to test. It was a completely different attitude towards testing. So I guess one of the best things you can do is adjust your attitude, that you're like, wow, this is a manageable disease. I can work with this. I can find out what my glucose is. I can deal with it. Just be grateful that you have these tools, which, there are more tools available every day, and it's 100 times more than what was available when I was a kid trying to figure out what to do. So what I did do is interesting, because I didn't go through the emotional issues a lot of people do when they get diabetes, like, the anger, all those stages till you reach acceptance. But what happened was when I first got my first meter and I was in my mid-20s, I went through that. At that point, I'm like, oh my God, I have diabetes. And it was just like, I was struggling with it. And what I did do was, for years, I wrote down everything I ate, everything I did, every bit of insulin that I took, and until I could really figure out what was going on, what food did what to me, what exercise did what happened at this time of the month, what's the effect of stress or lack of sleep and everything. And I found that was very useful. I don't do it now because, I stopped doing it when I first used an insulin pump, because then it was like you write down how much insulin you give 18 times a day if you give little bits, and so it got a little bit more complicated. But I feel like that those years of journaling and writing that all down was very helpful to understanding the different impacts of foods and activities and events in your life that may be going on. The other thing I think that was really helpful to me, and I'm not suggesting that everybody do this, but was going through 3 pregnancies with diabetes. I did have a meter at that point. I did 2 on a basal bolus regimen and 1 on a pump, so I've done it both ways. And what that made me do, though, was be very aware of the minute effects of every bit of food that I ate, every activity. And I got in the habit of checking not just before meals, but an hour after a meal, 2 hours after a meal, and in the middle of the night, because sometimes in order to really control for the foods, you have to check after you eat several times and then adjust if you're not. And if you do that, then your A1C will be very good, because you don't go up and stay high for a long time, like until the next time you got a meal 4 hours later. Then you're like, dang, I've been 300 for the last 4 hours. No, that never happens, because when you're pregnant, you don't ever want to be above 140 even an hour after eating. So you always want to be on top of it. And so just getting in that habit of checking more often, and wanting to have normal kids.
Yeah.
And I've just continued to do that throughout the rest of my life. My oldest son is 21 today, so I've been doing this for at least 22 of the years that I've had a meter, which is most of the time I've had a meter. I've been really diligent about checking frequently and checking at different times of day and finding out the effects of various things, and not just assuming, hey, if I'm always good at this time of day, then nothing else is going on during the day, because that's just true.
Yeah, no, that's all. I think that's great advice, and I think it's that, like you said, it's just a matter of perspective. It's literally one word sometimes. Instead of I have to do this, it's I get to do this, because it's just as far as it goes, I credit having diabetes with the reason I am so healthy today, because most of my family, other than my mother, is obese, and not just a little bit obese, but I mean really obese, and eats very poorly and has little to no concern with their health. And I know that it would have been very easy for me to follow that path. And in fact, I did follow that path, from the time I was 12 to almost 20 years old. I was 200 pounds. My A1C was 13.5% or more. And I had the propensity to go that way. But then after I realized it wasn't a bless or a curse, it was more of a blessing, so that you can know yourself. And sometimes, like you said, for people who can't get pregnant, men or other people, it's like finding a motivation outside of yourself to motivate you, because we will inherently as human beings do more for other people than we'll ever do for ourselves. So you have to find that motivation. Do you already have kids, or is there somebody in your life that's special, your spouse, or that you want to make sure that you're around for, or at least when you are around, you're not being mean or cranky because you are 300, and you're treating them like crap because you feel like crap, and it's just like this vicious cycle of, finding that external motivation is a really good thing. So that's a good point as well. So is there anything else that you would like to share with us about your story? Any other particular struggles or triumphs or anything, or do you want to?
One other struggle, I guess, is that I did go through some problems with retinopathy when I was in my 20s, and basically because I'd gone 18 years without a meter, and then there's quite a bit of evidence that shows if you go from not great control to good control quite rapidly, that you can precipitate the onset of diabetic eye disease. They found that in people who are pregnant, who are all of a sudden now trying to stay in a really tight range, that they'll develop retinopathy. So I did develop that in my 20s, and it was a really scary time for me, because I had read, like you, I'd read everything about all the complications, because my first job was as an exercise specialist in a diabetes treatment center, and I didn't have a lot of patients to work with initially, and they gave me all this paperwork and said, read all this. I read this book about this thick. It's like, these are all the diabetic complications you're going to get. And so it was almost a case of knowing too much, and then starting to get, like medical students sometimes start to get thinking that they have all these diseases they're reading about. But anyway, so I guess the hurdle for me was the fear of developing one. And then once I did develop it, was just dealing with it. And for 2 years, my eyes were quite unstable. I had to have a lot of laser treatment. And they have better ways to treat it now than they did. This was back in the 1980s. And, I wasn't sure if I was going to be blind for the rest of my adult life. I did have a couple retinal beads, one in one eye, and then that blocked my vision, and one in the other eye within a week. And so I was legally blind for about a month.
Oh my
but
God.
I kept doing a part-time job. I was staying with my mom then. She drove me to my job, which required data entry, and have to wait till I could see through the cloud enough to, but I was still good at it. I didn't tell anybody, just kept going, and it cleared out, and I do have all my central vision, but I had so much laser that it's done in the peripheral parts of the retina that I don't have very good peripheral vision, and my night vision is not great, but I'm just so I'm thankful to have my central vision. They're just annoyances. It means I step on my cat sometimes, and that sort of thing. It's something that I just have learned to live with. But I found interestingly that having gone through that one complication, my fear of any other complications has just gone away completely.
Right.
Not that I won't ever have any, because I did have to have cataract surgery in my 40s, and it's not that you can't develop cataracts in your 40s. My stepmother did without diabetes, but my doctor seemed to think that mine were related to fluctuations in glucose. It's probably sort of a residual thing of 18 years without having a glucose meter. But the silver lining is that I used to be really nearsighted, and so I had them put in lenses when they fixed my cataracts, so that one eye is good for reading and one's good for distance, and I don't have to wear glasses or contacts anymore. So I'm really actually quite grateful that I had cataract surgery.
I mean, I love that you even said that. It's like turning it onto its head, turning something that could be easily perceived as a reason to just kind of give up and say, well, I have these complications and now my life is ruined. But no, you still went to work, and now you have this awesome, like, dual vision lens in your eyes. So,
and, it's really funny that having to deal with any kind of physical limitation. I guess even when I was a kid, when I was in high school, I thought I was going to die before I got out from diabetes. I really thought I was not going to make it through high school, because everything I'd read up to that point, that was before I had the big thick book to read, just told me I was going to have a really short life with diabetes. And I remember finally telling one friend in high school, and her dad was a doctor, and he came back to me and said, "You're not going to die, soon. You can make this work." This is without a meter. So, right. I guess I've always had a pretty highly developed sense of my own mortality, which is good in a way, because I don't go blindly along thinking, "Oh yeah, I get 18 more perfect years to come," because I don't ever make that sort of assumption. I mean, I'm 51 now, and I'm in very good health, and there's no reason why I shouldn't live another 50 years. But anything can happen to anybody. I've been surrounded this past year by people developing cancer. My aunt's been struggling with it for 5 years. My mother, my sister-in-law with pancreatic cancer, and I just keep thinking the same thing that Gladys Dole told me, who was a woman who made it to age 93 with type 1 diabetes, who'd been diagnosed in 1924 and on insulin since it was commercially available. And she told me a story about her sister that she watched suffer from Alzheimer's. And her comment about her sister was, it was just so horrible to see her go through it. And Gladys was just so happy that she had diabetes. Yeah. And interestingly, she outlived all of her siblings and her husband, and she was the only one with diabetes. So I just keep looking at it that way, like, well, there's so many worse things that you could have. And because you have diabetes, you are at higher risk for developing things like pancreatic cancer and the things associated with insulin resistance and an unhealthy lifestyle. But so why not be the healthiest person you can be with diabetes? There's absolutely no reason why you can't be that person.
Right. I agree.
The only thing wrong with you when people say, well, how's your health? You say, it's great, and I have diabetes.
Right. Absolutely. I couldn't agree more, and I think that's another perspective issue that I have. That's the same experience as my sister was a drug addict, and she passed away at the age of 41. She had cirrhosis and hepatitis C, and I would I've seen a lot of things. My uncle has liver cancer. He just got diagnosed about 4 months ago. My aunt passed away of first colon cancer, which spread to her stomach, and she had colon and then stomach cancer. And like you said, it's like I would gladly be diabetic for the rest of my life versus to have to deal with something like that. And it's not necessarily you should go around comparing yourself to everyone else, but you can have the perspective of, well, I have a disease that is my actions can control the outcome, versus where when you have something like pancreatic, liver, colon, or stomach cancer, you could take all of the right actions every single day and not make almost any headway and still, unfortunately, pass away quickly versus where we are now. So I really like that point as well, because it's a lot of people lose that perspective when they're kind of in their own bubble. And we do all get into our own bubbles sometimes, you know, pity, why me? Why did this happen to me? What did I do to deserve this? And it's kind of like, you didn't do anything to deserve it. Everybody has their crap. Everybody has some crap that they have to deal with in their lives. This is just ours sometimes, and sometimes there might be more than this, but it's, you know, it could be worse, and it could be you could take all the right actions and nothing goes right, whereas if you consistently take the right actions here, most likely you're going to see some pretty positive results, and it doesn't take that long. That's the other thing I like to tell people about changing your A1C, if that's a goal, or changing your physical weight level. You think it's going to take forever, but if you're consistent for 3 months, which is really not that long in the grand scheme of things, you could see astounding differences in 90 days or less. It doesn't take a whole year, and it's just and when you see them and you feel it, that's empowering, that's motivating, that makes you want to do more. And it's like an upward spiral instead of a downward spiral. You see what you can do, you see the results that come from it, and then you want to, what else can I do? How else can I do this? You know, it's just that's good. So thank you for sharing all of that. And also about the retinopathy, I would have no idea, and I think a lot of people probably don't know that about you. So yeah, that's a scary thing to go through, and the fact that you're sitting here today and just rocking and rolling, I love it. So yeah. So I always ask at the end what your top 3 actionable items are, and they could be anything, literally anything that you feel that out there for those of us who, you know, may still be struggling or feeling kind of helpless or in a spot where we're not sure what the next step is to take. What would your top 3 actionable items be to kind of make progress?
You know, I think the number 1 would be to live your life first and be diabetic second. And all that is a perspective shift. It just means that you don't let diabetes dominate your life. And part of the way you keep it from dominating your life is by keeping your domination over it. I'm speaking to the dominator.
Yes, that's right.
You actually want to control it so that then it becomes a background thing. It's really funny because I spend most of my life focused on diabetes since I've chosen it as a career path, and yet in my own personal life, it's a very minute part of my life. I wouldn't even say it's an annoyance. It's just something I remember to do. I get up and I check my glucose. Oh, we're going to go for a walk. Well, let me check my glucose first. Oh, I got to eat something. You know, it's not a big deal. It's really not. And I'm so grateful to have a disease that is manageable that way, so that it can almost be background noise for me. My second point would probably be that it was an interesting talk. I don't know if anybody's heard Bill Blonsky's talk, but he's really well known in dealing with the psychology of diabetes.
You say that again because it got a little muffled there. What was the name?
Bill Blonsky. He's really well known. Talking about the psychology of diabetes, and I had to follow him in a speaking engagement not long ago where he spoke first, and he's very motivational. So, but one of the things he said that stuck with me the most was that he asked the audience. He goes, you know, what does diabetes, how did he phrase this? What is diabetes the cause of? And people are like, you know, heart disease, blah, 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 and you know, neuropathy and retinopathy and kidney disease. And then he goes, basically, you guys are all wrong. Well-controlled diabetes is the cause of nothing. Absolutely nothing. So if you can manage to control your diabetes, at least even moderately well with, you know, exercise really helps. Because everything I know about exercise now, it actually provides a natural antioxidant effect. So everybody's into taking antioxidant supplements to increase longevity and keep them from getting diseases. Well, exercise does that naturally. So it's just remember, well-controlled diabetes is the cause of nothing. And then the third point I think we've already kind of talked about, but it's basically it's a perspective shift. I view diabetes as something that has actually made me a healthier, better person than I would have been without it, and therefore it's a part of me, and if I hate it or resent it, there's a part of me that I'm not accepting of myself. And so years ago, we learned to cohabitate. My diabetes and I, we go everywhere together, but I don't feel chained to it. I don't feel like, oh, poor me, I have to live with this 24/7. I need a diabetes vacation. It doesn't really work like that for me. But I think, again, that's a perspective shift, that if you realize that if you work with diabetes, it actually makes you a healthier person than you probably would have been without it, then it's really a godsend to have it. Yeah. And I'm not saying that would be anything wrong if a cure came along that all of us could to not have it anymore. I'd say go for it. But if that cure doesn't come along in my lifetime, I'm not worried about it. It would be nice, but it's not necessary. I'm fine with being the person I am with diabetes at this point.
Right. And I think it's huge, that perspective shift. It's I teach people probably more than anything else is about self-love and self-acceptance, because until you can love yourself and accept yourself for who you are, all of the things you are, whatever that is, whatever happened in your past, whether it's diabetes or not, things that happen to everybody, and that doesn't define who you are, but you have to love yourself for all of the parts of yourself. And I think that's the thing that people have, especially diabetics, or us people with diabetes, so I can be more PC, is that we have this issue of a lot of us saying we're not defective, we're not messed up, we're just regular people that have this thing that kind of comes along with us, and that's it. It doesn't have to be any more complicated or deep than that, and accepting that and embracing it, really. It's more just accepting than embracing and saying, look, I have diabetes and I'm awesome, and that's pretty much all there is to it, you know. But it's a lot easier said than done. But just like anything else with exercise, you have to practice. You have to practice being nice to yourself, being kind to yourself, giving yourself the attention that you need, and all that kind of stuff. And I just want to say one other thing, and get your opinion on it. But I have a lot of people that come to me, and they say, oh, I can't exercise, or I have, tendonitis, or I have any number of things. But I am a true believer that there is a form of exercise for every person, no matter what the situation is. So when I say exercise, and I just want to make sure you're coming from the same place, it doesn't have to be some massive, intense, sweat dripping, pouring session to be considered exercise, right? I mean, do you feel the same way?
You mean like CrossFit?
Yeah, like CrossFit. It doesn't have to be CrossFit to be an amazing workout.
There's a form of physical activity or daily motion, or whatever you want to call it, that will work for everybody. And interestingly, when you are coming from a level of being less active and less fit, when you do something, it has a bigger impact, and it's going to have a more positive benefit on your diabetes. Now, those of us who are regularly active, if we stand up for an extra 30 minutes today, it may not make a big difference. But if you're not doing anything and you stand up for 30 minutes in 5-minute segments, it'll have an impact. And so there is something that everybody can do.
Right. Awesome. So yeah, so just make sure that you know out there that every little bit counts. Even if you say, you don't have 30 minutes at a time, break it up into 5-minute increments. Break it up into 10 minutes, 10 minutes in the morning, 10 minutes at lunch, squats at your chair at work, any little things, every little bit counts, and every little bit that you do is better than every little bit of nothing that gets done. So don't feel like, oh, I might as well not do it because it doesn't count, because it all counts. All right, so that's my final thing as my cat rolls around in the background. So if you have anything else to add, otherwise I don't want to cut you off. But do you have anything else you'd like to tell the audience out there?
Just say, go out and live a healthy life.
Yeah. Okay, awesome. Well, thank you so much for joining us. And like I said, I will link every website that Dr. Sheri has under this video, so you can go check out her and her books. Because actually, really, one of the first books that I read, and this is years ago now, honestly, don't know how many years ago because I'm not sure, but that inspired me was the one where you interviewed. That was that I ordered all of the people who had lived a long life with diabetes, because I had a fear that I was going to die young, you know, when I was younger. But when I read that book, I was like, okay, I can totally do this. Like, it was very helpful for me. So you know, if you're having that fear, I highly recommend, and I'll put links and all that stuff. But yeah, so thank you for writing that book. Thank you for joining us today, and we'll see you on the next episode. All right, guys, take care.
Thank you.